All right. How fun was that?
That was fun. It's really interesting.
You call it interesting. I call it like the most anxiety-provoking process.
I can see how it's anxiety-provoking because you have to do it with your guest there.
Yeah. That's the issue because you have to set up the camera.
I was resisting the urge to talk to you the whole time. It's like, just let him concentrate.
Oh, you can. It's okay. Yeah. It's for the most part, it's a streamlined process at this point. So, yeah, once the audio's set, that's the easiest, and then you got to set up the angles for the camera.
It's impressive.
Well, thank you. Welcome to the show. All right. I'm glad you stopped by. I've known you for a few months now. Yes?
Yep.
Okay. So we've known each other for a few months. And I think at the time that I met you, you were writing your book.
I think, yeah.
Mm-hmm. You were very busy. I have the book right here, actually. Okay. The book here, written by Mayra Diaz, The Panic Attack Relief Workbook. Okay, all right, that's important.
The wordy title there.
Okay, so I always like to start off with an introduction. So tell the people what you think they should know about you.
Sure. Well, I am a SoCal native. I was born in LA.
Your name is Mayra Diaz?
Sorry, my name is Mayra Diaz. That's the most important part.
Hey, listen, I do that so I don't have to do it anymore. So. All right, go ahead. Yeah.
Okay, going back, so it'll be easy for you. My name is Mayra Diaz, and I'm a SoCal native. I was born in LA, but I've moved around a bunch of SoCal. I went to elementary school out in San Gabriel. I went to high school out in Lake Arrowhead. So I don't really have a hometown. All of Southern California feels like
You don't have a hometown?
Yeah, no. I've moved around a bunch, but LA feels the most like home.
So if someone asked you where you're from, you would say LA.
Yeah, probably. It
That'll
feels
work.
the most like my spot.
That'll work. Yeah.
And I came back for grad school, and I'll probably stick around.
Lifetime?
Yeah, I don't think there's anywhere else I've found that has a diversity of people and things to do and this weather when it's not 1,000 degrees in the valley.
The weather, man. You can't beat the weather. I'm telling you. I can't wait for fall to come around because fall is like 65 degrees, maybe 40 at the worst.
At the absolute worst.
East Coast is like 0 degrees.
How have you been liking your return to LA? Or this is your first time living out here, right?
Second time. Second time. I left for Baltimore, then came back. I was there for 2 years. You know, it wasn't that much of an adjustment, to be honest with you. I going to Baltimore, I'm from Virginia, so that it wasn't like that was too far off. You get all 4 seasons out there: winter, summer, spring. You get everything. Here, though, it's like it's one season all year that gets a little colder, maybe a little hotter than usual, and then you're just back to the norm.
How do you like that?
Yeah, it's good. I came back.
Sure.
I came back. So it's good out here. I got a lot of friends out here, so decided to make my return. All right, we know where you're from, and we know what you do. Why did you choose that profession? Why did you become a therapist?
Sure. I was always one of those people who knew what I wanted to do. I knew since I was like 13.
You're kidding.
Yeah. I feel like I'm built for it.
Yeah.
I've always been told I'm a good listener, and I'm just a really big geek about psych concepts. I really like learning about the brain, and I just really like helping people. So it was just always a really good fit.
Wait, so since you were 13 years old, you've always known you wanted to be a therapist?
Yeah, I just knew I liked talking to people. I knew I liked hanging out with people, connecting, conversing. So yeah, this has always been my path.
Okay, so what you did? 4 years of undergrad? Like, what did you have to do?
Yeah, I went to UC Santa Barbara, and then right after that, I went to Cal State Northridge for grad school, and then just started working as a therapist from there. Okay,
so this is what I've learned. All right, you're LMFT, correct? Yep. Okay, this is what I've learned. If you want to focus on anxiety, panic, or depression, or OCD, or whatever it is that you want to specialize in, you have to seek out those supervisors.
Yes.
Okay. You had to do. Okay. Where did you get all of your training for panic and anxiety, and I think you do OCD as well?
Yeah.
Okay.
Yeah.
Where did you learn how to?
I stumbled into it, really. I found a private practice with a man named David Plotkin, who his practice focuses on anxiety, essentially CBT for anxiety.
Okay.
So I got a lot of my foundational training there on panic, on generalized anxiety, beginnings of my training on OCD. And then a lot of it was just really self-directed. I went and I sought trainings. And then more recently, I just got hooked up with, I've discovered there's a whole group of people. There's an anxiety OCD specialty group. I found them on Facebook.
Facebook
Now,
groups,
right?
course, yeah.
Right.
There's
So
one
now
for everything.
part of a couple consultation groups where I'm just kind of constantly learning and finding new things to learn. And it was great when I was writing the book. And that was a large part of my rewriting, realizing, maybe this isn't quite right, or there's a better way to do this, going back in, tearing things out and making it the best it could be.
I think you mentioned that you had to do a bunch, there's lots of work that goes into making a book.
Yes.
Yes. How many months total did it take you to write the book?
It was some pretty crazy deadlines. It was about 3 months
Okay.
for the whole book.
Okay.
And they told me I was 36,000 words, which at the time I was like, I don't know what that means.
Right.
I don't know if I have the capacity to do that, but I did.
Right.
So it ended up being about 200 pages, including the index and the resources and stuff like that.
Yeah, it's an easy read.
I'm happy to hear that.
Especially the first, because I think you have to set the foundation, because you need that psychoeducation to let people know what's going on with them, why they're experiencing this. And I think the first 2 or 3 chapters, I think, did a great job of doing that. So.
Yeah, they gave me an outline that I could write to, and I thought that was actually interesting because it really made me think more about how the reader would read through it. Because I think if I had just, written on my own, it really would have been, these are the things I'm interested in, and this is the way that I would deliver it.
Right.
But, I would have to have conversations with them about this activity. We understand where you're coming from. My editor would say something like that, but it's going to get messy when a person is sitting down and writing it out. That's not going to be easy for them to digest, or making sections shorter so that people would be willing to keep moving through it so that it didn't feel like it was overwhelming.
Right.
So I thought it was great that I had that kind of feedback. And now when I talk to people about it, they'll say things like, you can move through it easily. And I think it was because I had a lot of great guidance.
Well, this is your opportunity to expand on that. Anything you had to take out, now's your opportunity to expand. All right, so let's talk about anxiety and overarching diagnosis, and then I guess we can hone in on panic. What interests you the most about anxiety?
So many things. I really like that it's a straight line, or it feels like a straight line. I think other issues like depression or trauma can be more complex and harder to untangle. But with anxiety, it's really understanding the fear structure. It's understanding your trigger. It's understanding the behaviors related to that trigger. And we know what creates fear, which means that we know how to essentially change your brain so that it learns a different way to respond to fear. So I really like that it is that straight line that you can just show to people. A ton of my clients come to me, and I find, like I've said in the book, most people's issues with anxiety are because it feels like a mystery. It's a lack of understanding.
Right.
So it's really like when people come to me, being able to give them the information and help them see it's not anything fundamentally flawed with you. You just weren't taught how to deal with this. And there is real science that we can use to help you take your life back.
All right. If there's something that you want the public to know about anxiety that people typically don't, like when patients come in to speak with you, you just said it, you have to educate them on a lot of things. What's something that you think the public should know about anxiety that they don't?
I would say first, so the amygdala is that part of your brain that signals to your nervous system to start all those fun anxiety symptoms. So I think it's really important to understand how the amygdala learns. It doesn't learn through logical cause and effect. If you're bit by a dog, it doesn't understand, oh, that dog was the perpetrator of your pain, so that's why you should feel fear. It just associates any kind of information that comes in when you feel fear.
You're saying it doesn't think deeply about these things?
It does not, sadly. It is just, your experience, something around you gets associated with that experience of fear and then flares up again. So often people come to me and they're very frustrated or really getting down on themselves that they are afraid of things. Public speaking, swimming, whatever random things we can be afraid of, they're taking it as a sign of weakness. Right. And I really like to help people understand it's not a sign of weakness. Your brain just paired something with that trigger, and it's just going to keep doing that until we teach it something new.
Yeah.
So it's not anything about you. It's just having to learn that relationship that will help you be able to break out of it.
Yeah. So research in psychiatry,
Sure.
well, mental illness in general, the amygdala is like one of those things that people love talking about.
Absolutely.
I don't know what the most primitive part of the brain is, but I know the amygdala is like up there in top 5 or whatever it is. It's very primitive. So yeah, it doesn't really make those distinctions like the frontal lobe might,
Exactly.
or you think on a deeper level.
Yeah. And that's how we get stuck. Another thing that I say to my clients a lot is that fear is convincing. It's meant to be. So when you can't get out of your house, when you're too afraid to ask a girl out, when anxiety is standing in the way, it's doing its job. It's not anything. It doesn't mean anything about you. It's just doing what it's meant to do.
Yeah.
We're supposed to listen to fear to survive. So you're really only doing the only logical thing. But the problem is that your brain can misregister. It can interpret something as dangerous when it's not. And so we just have to help you learn to deconstruct that. But because your body is responding in this way, doesn't mean anything about you. It just means that you're trying to survive. Something else that I think is important to know about anxiety is that it's normal, that it's natural.
You can't avoid it.
Yeah, I have a lot of clients who come to me, and I think, again, this is a consequence of our TikTok world. They'll come to me and they'll say, I have anxiety. I need to get rid of it. And I think we have labeled anxiety as a problem instead of we all have anxiety. But the issue is your relationship with it, and we can help you have a healthy one. So I think people being able to learn anxiety isn't a problem. It's a feeling, and it can be overwhelming, and it can absolutely take over your life, but it doesn't have to. And you can have a good life with it because it's meant to protect you.
I would be more worried if someone didn't have any anxiety at all.
Yeah, that would be a very, very scary symptom of something else.
That's a whole nother category we won't get into today. Okay, so now we're going to talk about panic.
Sure.
What is a panic attack? And I think you made a distinction in your book between a panic attack, panic disorder. Okay, can you talk about that a little bit more?
Yeah, a panic attack has actually a very clear and basic definition. It is essentially just a rapid spike of fear, and that's how it's going to be different than anxiety. Anxiety is usually slower building. With panic, you can tell. I just shifted into this fear state really quickly, paired with 4 physiological symptoms. And it's a pretty big rainbow of the kinds of symptoms. So there are the typical things like your heart's beating, your face is red. But then there are other kinds of symptoms that might happen in your body that are also signs of panic, like your fingers tingling or becoming nauseous. So in my book, I actually list all of them. There's something like 20 different symptoms.
I saw, yeah.
But basically it is
list.
just, thank you. But it is just that spike of fear paired with 4 physical symptoms of your nervous system indicating that you're experiencing panic. So it can look very different from person to person, and you can be having a panic attack and not even know it because nobody showed you that's what it would look like.
Right. Have you ever seen the show The Sopranos?
I have, yes. I am not a fan of how that therapist was trying to handle his panic, to be completely honest.
In fairness, that was a psychiatrist.
Sure, that is true.
Therapy.
That is true. I'm having trouble remembering the exact specifics of what she did, but I do remember when I watched it thinking, that's kind of the opposite of what I would do. I think, she essentially told him, so this is the other thing that I think is important to understand about panic that most people don't. I think it's great that we're destigmatizing mental health issues. I think it's great that we're spreading information, but in a TikTok era, a lot of what people are learning is pretty distorted. What I find is often what people think is the answer is to learn all kinds of regulation strategies, deep breathing, muscle relaxation, meditation, and none of that is bad, but if you're using it in an attempt to stop feeling anxious, then you're just reinforcing fear.
All right.
So when it comes to The Sopranos, I think she was doing things like that. I can't quite remember, but I think it was essentially, don't think about your panic. It wasn't helping him learn he could sit through it, that it was something that he could tolerate, that escape from it was what was bringing it back all the time.
Yeah.
And I think that he might have fainted on the show. I can't quite remember.
His initial symptoms was fainting. He fainted every time.
Yeah. Okay, so I thought I remembered that right. Panic is typically contradictory to the state of fainting.
You don't really faint typically.
Yeah, it can happen in rare situations, but so I think The Sopranos gave a whole population of people this fear that they're all going to faint from panic when that doesn't really happen.
I just rewatched the whole show. That's why
it is fun. I do like the show.
I know. But this is one of the things that happens when you get involved in a business or an industry or a specialty, and you know all about it, and you see a movie or some portrayal of it, and it's nothing like it is in real life. You like, oh, that's not.
Yeah, I steer away from watching therapists on TV.
Well, you don't watch any shows with therapists on?
I try not to.
Really?
I don't typically find, oh yeah, you're doing great stuff.
I like that. Anyway, okay, all right. Sorry. That was a big deviation.
I didn't answer your other question about panic attacks versus panic disorder.
Okay,
So
go ahead.
coming back to that, a lot of people have panic attacks. It's actually pretty common.
Yeah.
So having a panic attack itself is not a sign of a mental health issue. It just is a sign that you felt a spike of fear, that something came up that likely made your body feel like it was in danger in a very immediate way.
Okay.
So that is pretty normal. Panic disorder, the difference is when you start having more and more panic attacks, when the panic attacks are increasing in frequency and they're starting to get in the way of your life. And really the defining feature for panic disorder is when you're planning your life around your panic. You're avoiding things because you don't want to panic, or you're constantly monitoring your own body trying to prevent panic. That's when it starts to become a disorder. Essentially, when it feels like your relationship to panic is taking over your life, that's when we would diagnose that as panic disorder more likely.
Okay, so one panic attack per year, not necessarily an issue, but multiple panic attacks, and then it's the changing and rearranging of your life.
Yeah.
When it becomes a disorder.
Yeah, when it starts to get in the way of your life and it's stopping you from doing things you care about. Maybe you don't go to theme parks, you don't exercise, you don't public speak because you're afraid of your panic.
I didn't learn about this until I was in my late 20s. I may have had panic disorder when I was a kid.
I think a lot of people have without realizing it. Because I think actually what happens too is often it's not labeled as panic.
Yeah.
Really what's just going on is your body feels weird and you don't know why, and you're just trying to make things stop feeling weird. And that could actually just be panic disorder. Nobody ever gave you the title, oh, that was a panic attack. And now you have this disorder.
Yeah.
So how'd you get out of it?
I didn't realize. So I was playing football. I was a freshman, and I ended up on the varsity team. We weren't very good, so I was on the varsity team, but we weren't a good team. So good, but not that good. Actually, once you think about the record. But anyway, the second year that I was starting on the team, I was on the field. It must have been like 105 degrees outside, and I was having trouble breathing. I felt like it was like everything just got dark. I didn't pass out, but I was about to. And
I felt like you were going to.
Oh, it was a problem. And I think I did like 2 more plays. Like it wasn't good. So what would happen then was I thought that it was because I was outside and I was overheated and I was running. So I stopped running. Like I avoided that as much as possible. I was still on the track team, but I could do like field events and I would just not run. Now, what I noticed is that if I wasn't on the football field and I ran a little bit, I was fine. But when I was on the football field, that's when I had issues. So I wonder if it had something to do with playing football and running.
Yeah, again, your amygdala could have associated the field, because really what's going on with your brain is it's just associating any sensory input, any kinds of sensations you're getting when you feel fear.
Yeah.
You compare that with your trigger. So it could have been the grass. It could have been the smell of the field. It could have been what the field looked like, that became an association in your mind.
I don't. So what I did, essentially, I just stopped playing football and then I got better. I started running more like 3 years later and I had no issues.
You found your way out. But yeah, that does sound like that was probably panic disorder, and nobody was labeling that. Nobody was helping you with it.
Well, I got checked out by a cardiologist. Nothing wrong with my heart. Socially, it was a problem because you stopped playing football, and in
You're
Virginia,
not as cool.
it's a whole other issue. People would ask me how my heart's doing, and I think that was kind of they weren't actually asking about my heart. They were asking about my heart. Like, yeah, it's a whole other. I haven't forgotten that. Anyway.
So even for you at the time, people were interpreting it as though it meant something about you.
Yeah. But I don't think anyone was thinking that.
Yeah.
Because I never had issues before or even after that. So, but anyway, okay. So that's why this topic is near and dear to my heart. I'll never be able to prove it, but It's always in the back of my head. Okay. So did we talk about how to know if someone is having a panic attack? We briefly discussed that, yeah?
Yeah, I gave you the definition. So it's that spike of fear
Yeah.
and then those 4 physiological symptoms. If you're an observer, what that's going to look like is if you see somebody, you can have a panic attack and it can be kind of completely invisible to people outside.
Yeah.
But when it's obvious, you're going to be seeing somebody with very dramatic symptoms, hyperventilating, shaking, trembling, hot, seeming maybe a little incoherent. That's what a visible panic attack would look like.
Okay, but it's not always visible. Sometimes the hands are just tingling. The nausea, that's a big one with anxiety too.
Yeah, you could have your hands tingling, you could feel nauseous, you could have just a little bit of shortness of breath, and you could have one of those strange sensations, derealization or depersonalization,
Yeah.
and no one would know.
How do you think your book is going to be helpful for people?
I think it's delivering a lot of the education that people don't get. It's just really breaking it down in clear, digestible ways, and it's giving you a step-by-step plan. What I ended up doing with the book was really just sitting down and writing what I say, what I do with my clients every day. So you get that path for yourself, and you can use those tools to break out of that cycle.
Right. 3 things that I think you mentioned in the book, ACT, CBT, and exposure therapy.
Mm-hmm.
Okay. So just briefly, could you explain what those 3 different modalities are and how they apply to panic?
Sure. So the first and most important one is probably exposure itself. That's essentially what we do with anxiety. And when it comes to panic or any kind of anxiety, it's about learning what your triggers are, and again, those behaviors that are related to it. Because what we start to do when we feel anxious is we engage in these behaviors that are meant to protect us. But if the thing that we're protecting ourselves from isn't dangerous, then what we're doing is just reinforcing our fear of something that isn't dangerous.
Mm-hmm.
So when it comes to exposure, it's learning what those behaviors are for people and learning what those triggers are, and then slowly, gradually helping them face their fears. Because if you face something that isn't dangerous, or if you face something and nothing dangerous happens, your brain can learn, oh, I don't need to keep making you afraid to protect you. So that's really the whole point of exposure therapy. So it's really kind of the foundation of treatment for panic disorder. For panic specifically, what we talk about is interoceptive exposure. So normal exposure would be exposing you to something outside. If you're afraid of dogs, we would expose you to dogs slowly. Interoceptive exposure is exposure to your internal sensations. Because with panic disorder, what that becomes is a fear of the sensations of panic themselves.
Oh, yeah.
You're afraid that that means something terrible, so you start really trying to stop or avoid that. So exposure would look like helping you face those sensations on purpose, which sounds really awful and paradoxical, but in my day-to-day work with clients, it's really life-changing. When somebody might start hyperventilating on purpose and realize, oh my God, I didn't choke, or I didn't have a heart attack, or I didn't go crazy, that can really shake that relationship and break you out of that cycle.
So if you were a 15-year-old boy playing football,
Yes.
you would not recommend that he stops playing football. You would recommend he play a little bit.
I would recommend he play a little bit, and I would actually recommend we explore the underlying fear. Why are you afraid of playing football? And really, if you go back to 15-year-old you, what do you think you were afraid of?
I have no idea. I know I had started on the team my freshman year, and I didn't have any issues, but I wonder if the second year I was just trying to be better than I was the first year, and that just might have been pressure for me.
Sure. Yeah,
I don't
absolutely.
know. But I didn't have that issue with track, though. Oh, I did track, too.
I don't know what the difference would have been.
Oh,
That would
track
have been
and...
fascinating. Well, at the time, in your mind, what
Oh,
the
yeah.
difference would have been. That would have been fascinating to explore.
Well, people care more about football than they do track and field.
So more anxiety, probably.
Yeah, probably. But I made it to pretty high levels in track, national competitions and stuff. So the pressure was high there. And again, I'm not sure if it was panic. I don't know. I have no clue.
When it comes to panic, there are a few really, really common fears. Often it is that you're dying in some way. I'm going to have a heart attack. I'm going to stop breathing.
Oh, yeah. I was scared I was going to die, so I stopped playing.
That's it. That was your underlying fear. Yeah.
Forget that, man.
So when it comes to exposure, what we would design is, okay, how do you think you would die? Do you think you were going to suffocate? Did you think your heart was going to burst? How long would you have to run for? And then we would have you do that on purpose.
I'll tell you right now, I was afraid I was going to die of a heart attack. My heart was cleared, but I was afraid I was going to die of a heart attack.
So we would have had to stress your heart on purpose to show you through experience, hey, you're not dying. And then your brain could finally learn.
Oh, my goodness. Would I have done that? I probably would have. I would have.
I'm bummed I was not around at the time.
Yeah, as am I.
But so that's exposure.
Yes.
And so CBT, it's cognitive behavioral therapy. That's really learning, what are the kinds of thoughts that I'm having, the relationships between your thoughts, your behaviors, and your emotions, and learning to relate to your thoughts in a different way. Because your thinking patterns really have a pretty big impact on anxiety.
Yeah.
If you're worrying, the kind of thinking that you're doing, if you're ruminating, if you're problem solving over problems that are not dangerous, all of that keeps you in an anxious state. So CBT helps you learn to recognize your thoughts, to respond to them in a more realistic way. And then ACT actually builds off of that. So CBT is more about being able to see realistic versus distorted thoughts. And ACT or ACT is really building more on that mindfulness aspect of what we do in therapy and teaching you to be able to diffuse from your thoughts, that our thoughts and our feelings are our experiences, but what can happen is we can kind of join with them, we can hook into them, and then that can get really overwhelming. So ACT is a process of learning to get some distance and notice and observe your thoughts without judgment, and then anchoring your life in values, figuring out what are the things that I care about, and learning I can do things that I care about even when there might be some suffering because I care about them.
Acceptance and commitment.
Exactly.
That one I'm not too familiar with, actually.
It is, a newer wave of cognitive therapy, but I think it has a lot of value, talking
Sounds
about
like
values themselves. And really, if you attack, panic or anxiety with elements of all three, you can find what really works for people. When we were talking about ACT, I heard this metaphor from someone, and I've been using it a lot with my clients, and I think it's really helpful. I talk to my clients about, have you ever played a sport like you have or an instrument? And then I ask them, did that hurt? Was that uncomfortable? And inevitably, people will say, yeah, I had calluses, I was sore. And that's a parallel to our experience with anxiety. Sometimes you do things like going to a scary movie or giving a public speech, doing things that make you feel anxious. And it is going to be uncomfortable, but we do things that make us uncomfortable all the time because we care about them. You played track, you did football while you did because you liked it, I imagine.
Mm-hmm.
So we are capable of engaging with discomfort for the things that we care about. So if we can change our relationship with anxiety instead of it being a terrible monster and it just being, this is just kind of a part of my experience. And sometimes I'm going to feel anxious, but I am able to tolerate that. And for the things I care about, I'm willing to do that. That's how you can break out of feeling trapped by anxiety.
We've talked about how you might treat it. Again, very briefly, we don't want to give away the ingredients in the secret sauce, right? I wanted to stick to the first three chapters because, again, I mentioned that was a great introduction to the actual nuts and bolts of what you have to do to treat panic disorder. So now, how do you make a decision as to how to refer people for medication management if the therapy is not enough?
It's a good question. I think there are multiple points. I think you're just kind of constantly assessing. So in the beginning, if functioning is impacted, so the severity of your symptoms, are you not leaving the house? Are you not going to work? If you're really debilitated by panic, I'm probably going to refer you out to at least have a conversation with a psychiatrist. And sometimes what needs to happen is short-term relief, kind of more intensive short-term medication to just stabilize the client or patient, and then we can do the kind of work that we need to do. But then in the long term, if the client is doing the things, they're going out, they're doing their homework, they're implementing practices, they seem really engaged and they're still suffering, then that's likely when I would refer out. I would think about that as, I describe it to my clients as you can think about anxiety or panic or your symptoms as a weight that you're carrying. And sometimes that weight is just a little too heavy for you to carry. Maybe it's an 80-pound weight and you're trying and you're doing all the things and it's still just overwhelming. And so medication can make that a little easier for you to bear to be able to get benefit from this.
Right.
Or if they're not able to, they seem motivated, but they go home and they can't engage in exposure. They can't track their thoughts. They are unable to meditate and they clearly want to change, but they're really struggling implementing these things. That's when I would refer out to.
Right. It's no good doing therapy if they can't actually engage in or participate in it.
Yeah.
Okay. So you are in private practice.
I am.
How long have you? Okay. So you were writing the book when I met you. Okay. You had to take time off to write the book. Are you back full time in private practice now?
I was actually writing the book while I was mostly full time, so I had absolutely no life.
And you finished in 3 months. That's amazing.
3 months for the writing, and then another couple months for the editing.
Amazing.
It was a heavy lift, but I'm glad that it's out there now.
Yeah. So you are full time. So you're back at full time now, but you just have more time. Okay.
I have more time to have a life. I have more time for my clients.
Congrats. So tell us about your practice then.
Sure. I am in private practice currently virtually. Right after this, I'm going to go look at some office space. I'm looking to, to expand into maybe 1 day a week. I want to be able to get out of my apartment.
Awesome.
Have an office to come to. And I miss seeing people in person. So I will have the option of in-person appointments in some near future. And I specialize in anxiety, OCD, and working with people of color.
You miss people like in your office space?
I miss seeing clients. I miss coworkers. I miss, being outside of my home.
2 years ago, I didn't think I would hear that from people, but most people are like trying to get back into the office, trying to have in-person appointments. It's surprising to me. I figured everyone would transition to all virtual and stay virtual. Yeah.
What I will say is I get approached by clients who feel less anxious about being able to do the therapy in their own homes.
Yeah.
That anxiety would have stopped them from getting to the office. But then I also get approached by clients who feel anxious that it's not going to work if we're not in person, that it's not going to be exactly the right kind of therapy.
Yeah. There's some people that are like, I want in person. There's some people that are comfortable with virtual.
Yeah.
I've also noticed the people that have transitioned from in-person to virtual and they're already comfortable with the therapist. They don't want to go back to in-person.
Yes. I've asked my current clients, I'm telling them, okay, I'm looking for office space. Do you want to get back in the office? Most of them do not.
No.
Even the ones that were anxious about not being in the office in the beginning.
My theory on that is I think the virtual aspect of it, the beginning, that's tough for people to do virtually. But once they get comfortable with you, then it's fine. We can switch and we can just do all virtual. But in the beginning, a lot of people will want to see and hear your voice and actually be in your presence when you first start off.
Yeah, I think it might be a little bit tougher to build a sense of trust and safety in that relationship in the beginning.
Yeah, this newer generation, though, they don't give up. They don't care. They don't care. Okay. All right. I actually think we covered most topics. The only thing we need to do is we need to get you started watching The Sopranos again. Because I want to have that conversation with you. I love that show so much.
I want to hear about what other shows you're watching with therapists in them.
Oh, with therapists in them? There's one, I think, on, it's either Hulu or, I can look it up right now, actually. Give me a sec. It's called...
is that one where a therapist gets kidnapped?
Exactly.
Ooh, yeah, I'm scared of that too.
Why are you scared of it? You just 5 minutes ago you gave away the location of your office, and now
I gave a whole city.
Now you're afraid. Now you're worried.
I do actually enjoy true crime things, but anytime there's stranger danger, some random stranger breaks into your house, that's when I get the most afraid.
Let me ask you a question about that. True crime stories, which are horrific, some of them.
Yeah.
People love it. Podcasts. Some people like going to scary movies, even though they have nightmares afterwards. Yeah, why do you think people like to be afraid?
Well, fear and excitement really are operating along the same path. So I think it's kind of how you interpret that fear.
Okay.
And actually, ACT, talks about diffusing from your feelings and your thoughts and the ability to witness, oh, I'm feeling this, and not get swept up by it. And that's what going to a scary movie is. It's feeling afraid, knowing you're feeling afraid, but not getting overwhelmed and taken over by it, just being able to observe and enjoy the process.
Interesting. There are people that refuse to watch scary movies?
I don't like most scary movies.
Wait,
well,
what?
I'm okay. There's actually, I have a very weird experience around scary movies. If there's one person who's more afraid than I am, then I'm okay.
What? What's the psychology?
I don't know. It just makes me feel less afraid.
If you have someone that is more afraid than you are, you feel more comfortable.
Yeah. I have
Interesting.
no explanation for it.
Okay. I'll tell you what. Maybe I'll go in to see a therapist to work through whatever was going on when I was 15, and you'll find out what's going on with that aspect of yourself. Everyone pick up Mayra's book, The Panic Attack Relief Workbook, a 7-week plan for overcoming fear, managing panic, and finding calm. You can find it on Amazon.com.
Everywhere books are sold.
Everywhere books are sold. And your website?
My website is just my name, MayraDiazTherapy.com.
Any other Instagram? You got Facebook? Anything else you want people to find you at?
My Instagram is also Mayra Diaz Therapy. And if you're interested in more of my writing, I've got a blog on my website.
All right, we're all finished. Done.